We are in my home studio with this week's Live Wire. We have MCN Secretary of Health Shawn Terry. He's going to update us on the COVID vaccine rollout. And without further ado, Secretary Terry, it's your show, and I'll have some questions for you. Give us an update. How many doses have we done? Where are we at right now?
Okay, so we are in about week 3. The first round of doses that we got, we received a 460 doses of Pfizer vaccine, which was to start vaccinating the Department of Health employees. And then the following week, we received about 1,500 doses of Moderna vaccine. And we finished up health employees. We started with tribal employees, some of the frontline workers. And then we also started working through a list of our elders. And so each of our facilities has a list of patients that are over the age of 65 and or they also have some high risk factor. And the list goes from the oldest down to the youngest. So if you're 90 years old, they're going to start working on the 90-year-old list and the 80-year-old list, and then work their way down, and then also those with 70. We've also been working with the local school systems and asking many of the schools to start putting lists together, so that if we have extra doses at the end of the day, and maybe we have 5 or 6 or 10, and we need to call someone in quickly, we've asked people to put these kinds of lists together in case we just could to get some last minute doses in. And so then at the beginning of week 3, we received another 1,500 doses that we received on Monday of Moderna vaccine. And so we're going to be vaccinating that list of elders, some of the tribal employees again this week. And then all of that is going to have to come to a standstill on Wednesday, tomorrow. And then we're going to start back with round 2 of the Pfizer vaccine for all of those Department of Health employees that had received their first dose 3 weeks ago. And so it's been very, very complicated, lots of moving parts. And so in the first 2 weeks, we gave out roughly 1,900 doses of vaccine. And then the last couple of days, we're probably doing somewhere around 400 or 500 a day. And then we start back with, once again, round 2 tomorrow.
Well, that's great information, sir. Also, I'd like to tell the audience, if you go to the Mvskoke Creek Nation Department of Health's website, they have a COVID update page where you can get the distribution plan that has all the phases of the distribution, and also the vaccine information line number that's on the screen right now. Mr. Terry, who's getting it currently, and when, if we're not at the phase where just the average citizen can get it, do you have an expectation of when that can happen?
Well, we're hoping relatively soon. One of the problems, Jared, is we never know how much vaccine we're going to get and when we're going to get it. So logistically, that is logistically, that's the first challenge that we experience almost nonstop. So we can't be guaranteed that we're going to get this many doses on this day. We usually have about 1 day notice of when we're going to receive a shipment and what that shipment is going to look like. And so, as you can imagine, trying to schedule people with just a couple of days notice is very challenging. So each of the clinics has a list that probably has about 2,500 elderly patients on it. So we really want to start working through those lists. We also want to start working with some of these schools on getting the teachers and some of those frontline workers started. And so my hopes are within maybe the next 3 weeks or so that we'll be able to get to the tier 3 level and start doing more of the generic public vaccinations. And then right now we're also trying to work through some logistical issues as far as, is this going to be better performing these vaccines in our clinics? Because we still have sick patients coming into the clinics. We still have to take care of chronic patients, and we still have to refill medications and prescriptions and do all of those things, and trying to give out thousands of doses of vaccine. So, but getting back to your question, my hopes is maybe within the next 3 weeks. So but we'll see how it goes and how much vaccine we get and when we get it.
So it sounds kind of like we're getting the vaccine out as soon as we get it, and we're not holding vaccine on hand, because I know there's been a lot of news stories about the fragility of the vaccine due to the cold temperature storage, and also the expiration date of the vaccines, getting the vaccines administered before they expire. What does our Department of Health look like as far as those two things? Do we have adequate storage? Are we getting it out fast enough?
So the Pfizer vaccine is the only vaccine that has to be held in ultra cold storage. And so the only doses of Pfizer that we're receiving right now is been for the Department of Health employees. And we vaccinated every employee in essentially 2.5 days. So we're getting the Pfizer vaccine shipped to us. It's being shipped unfrozen. And then we've got 5 days to give that out. And so we've easily done that because it's just for those Department of Health employees. Now, the Moderna vaccine, it can be held for 20 days in just or 6 months in a regular freezer. It doesn't have to be ultra cold. And you can have it 20 days in just a refrigerator. But the Moderna vaccine comes in vials of 10 doses per vial. And once you puncture that vial, you only have 6 hours to use all of those doses. And so there's timelines that's happening with the vials and with the temperature, and it's kind of different for each brand of vaccine, and so that's something that we're having to watch very closely.
I see. My next question would be the lists that we were talking about of elders. How are those compiled? Is that they come into the clinic and they get on the list, they call the number and they get on the list, or how is that structured?
Yeah, so the first thing that we did was take our current patients that are registered at our facilities, and we pulled a list of those patients. of everyone that's over the age of 65. And then we broke it out by clinic. And each clinic will be calling the patients that are registered at their facility, and they're working through those lists. Then we also have new patients that they've never been a patient at one of our facilities, and we're encouraging them to call the hotline and or the vaccination line and get their name on the list. And then we're also prioritizing those as well. So there's a couple of different ways to do it. Some of our clinics, physicians are taking some of their highest risk patients and calling to get them scheduled in. Some of them are just working straight through the list from top to bottom. So it's been a little bit different at every facility. We've kind of given them the freedom to do what's kind of best for their clinic, and that also kind of as you can imagine, it's much easier for a Eufaula clinic that has a great big new facility to move patients through versus a Sapulpa that has a very old small campus. So every place has been just a little different.
Well, my question on the rule would too be like, so we have citizens that for their the actual administration of the dose, they have to go to a clinic. Are there any plans to send like community health reps out to give doses or anything like that? What is the status of that?
We've talked about it at length. One of the problems is once the vaccine, this vaccine is very fragile. And so that's why it's having to be shipped in ultra cold and frozen state, because once that dose is thawed, it becomes very fragile. So if it was bouncing around in a car on some of these Oklahoma roads, it would destroy the integrity of the vaccine. So we have to be very cautious about the way that it's transported and thawed, so that we don't destroy it.
Well, I want to thank you again, Secretary Terry, for giving us some time. I wanted to block out about 30 minutes. We're about at the halfway point, and I just wanted to remind the chat audience on YouTube, if you guys have any questions about the vaccine rollout, go ahead and put them in the chat, and I will ask the Secretary the questions. Is there anything related to the vaccine rollout that you'd like to mention in particular, maybe a success or an area where you'd like to see improvement, particularly maybe on the federal government level or anything like that?
Yeah, well, I can roll through some of the challenges that we have, but I think first and foremost, what I would like to do, Jared, is highlight just how important getting this vaccine is. Last night, at probably 6 o'clock, we had both the Okemah and Okmulgee hospitals completely full. We couldn't handle another patient. The emergency rooms were full. The hospital beds were full. We couldn't transfer patients to Tulsa. There was not an intensive care bed. And we've seen many of our citizens pass away. We've seen people get extremely sick. It's been a devastating virus, and we need people to get vaccinated so that we can get back to some normalcy. So first and foremost, I just want to encourage people that we have really looked at this vaccine. We believe it's extremely safe. We're all taking it. All of our medical people, the physicians are taking it, and we really want to encourage that. So that's first and foremost. We want to protect our people, and we want them to get vaccinated.
Along those lines, just to touch on that, what is there anything that the Department of Health is doing, maybe social media outreach or anything to try to encourage us? What are you guys doing on that front?
Yeah, so we put out some social media on our Facebook um, pages. We have it out on our website. Once again, you can click on that top uh, right-hand side to talk about all of the frequently asked questions. There's a video that explains what the mRNA vaccine is and how is it different from your traditional vaccines. Um, and we've tried to keep this out in front of people on social media. Um, Unfortunately, the last 3 weeks, I think everyone's attention has been on getting the actual vaccine out and um, doing that. But we can't do that enough as far as public awareness of how important it is to get this vaccine.
Yeah, and I also wanted to say thanks so much because my wife is a teacher at the College of Mvskoke Nation, and yesterday they all because the campus is going to be open, they're going to have in-person classes with PPE and everything. They also gave all the instructors doses of the vaccine. So I want to thank you personally. That was great. And if you guys want to do outreach, I'll be more than happy to go on camera and get the vaccine myself, because I think it's very important. Just like what you were saying, we need to try to get that out to citizens that it's safe and there's no problems. With the COVID vaccine, is there, based on the rates that we've been able to vaccinate people so far, is there a projection of when we could have most of the citizens vaccinated, or at least the ones that we have an idea of, that go to the clinics?
Jared, are just very preliminary guesstimates is we would really like to be able to get the vast majority of the citizenry vaccinated by the end of March. And that's going to depend on lots of things. And that's going to depend on, first and foremost, how much vaccine can we get and when can we get it. And so what really complicates this process is just like tomorrow, I have to stop giving first doses so that I can start giving the healthcare workers the second dose. And then the next week, I have to give people the second dose of tribal employees. So we're trying to find a balance to where maybe in the morning we will give out first dose shots, and in the afternoon we give out second dose shots. All of those logistics are being worked through, and it's very complicated. I don't know that there's any easy answers. We're going to be we're really looking at trying to pull every nurse, every medical assistant that's in the system and get them on board. And we just keep reinforcing with every employee in the Department of Health, getting shots into people is our number one priority right now. And so that's kind of what the next few months looks like. If I could get it done by the end of March, I think we would be very fortunate. But a lot of that's going to depend on variables that I'm not in control with, and that's how much vaccine am I going to get and when am I going to get it?
Right. Well, other than the information line, which the number is on the screen right now, folks, and you can also go to the Mvskoke Creek Nation Department of Health website and click the COVID update link and find all this information there, including the phases that the tribe will go through in its administration of the vaccine. Other than those things, is there anywhere else that people could go to get information about the COVID vaccine, or where they could get it or anything? Should they just call their clinic?
Yeah, they can always call the clinic. And and they can tell them when they're going to be giving vaccines, because once again, everybody's doing this just a little bit differently.
Oh, I hope we didn't lose Secretary Terry.
Like in Mulgi. Hello?
Oh, I'm still here. Can you hear me, sir?
Okay.
Sorry, we had a little stutter there.
Okay, I'm sorry. So I was just talking about, contacting each facility, and everyone's going to be just a little bit different. So don't get frustrated if you see Okmulgee doing one thing and Okemah doing something just a little bit different, because everybody's going to be geared to how many staff they have on site for that day. And we're going to be getting we've got some large tents that we're taking to each facility so that we can do a lot of this outdoors and in drive-throughs, so that patients won't have to get out of their vehicles, and we can still protect the public from all of the COVID exposure. So just contact your facility or that line, or go to our website, and we can find out from there.
Well, I'm really excited. I hope we can get everyone vaccinated by March. Maybe that'll put us on track to have festival this year. Thanks so much for coming in and taking time out from your busy schedule, because I know you guys are swamped right now. And thank you so much as a citizen for all your work that you do, sir. Again, I'd like to try to do something like this again with you in a couple of weeks, maybe get another update if you're okay with that, and I'll set it all up. And other than that, I think we're good. Is there anything you'd like to add, sir?
No, we'll keep our citizens and our patients fully informed as we're going through, Jared. So if we want to do this every week, and if we wanted to do it on a Monday, by Monday afternoon, I usually know what kind of vaccine I'm going to have for that week. And so I don't mind doing these regular updates. We would rather do it more than not. So happy to do that. And,
thank you so much. This is the question that I get asked a lot by citizens on the street: is what is the status of the vaccination? So, but other than that, I don't see any questions in the chat. So, thank you so much, sir, and I look forward to speaking to you again in the future. Mado.
Thank you. Be safe out there.